Good afternoon, everyone. Welcome to this exclusive masterclass titled The Elderly in India and the Role of Media by Dr. Sanjay Kumar, Population Dynamics and Research Specialist, UNFPA India. We are thrilled to have you join us today, sir. Before that, I would kindly request everyone to switch on their cameras, keep their audios muted during the masterclass, and please post your queries on the chat box. We will take queries at the end of the session one by one. If you would like, please raise hands and you can ask your queries yourself by unmuting. This is only during the Q&A session. I am Pooja Nagdev, Ladli Media Advocacy Coordinator at Population First. Let me introduce Mr. Yogesh Pawar, Program Director at Population First. He's a seasoned journalist with over 30 years of experience across print, web, and television. A TISS postgraduate in medical and psychiatric social work, he briefly worked as a marital and sexual counselor before diving into journalism. Over to you, Mr. Pawar.
Thank you, Pooja. Good afternoon and a very warm welcome to everyone to this special masterclass which UNFPA is supporting. Let's begin by talking a little. Let me tell you a little about Population First. It was founded in 2002 by the late adman Bobby Sister. Population First champions women's empowerment, gender equality, and community mobilization through media driven advocacy and mindset change. Our masterclasses are a key part of this journey, creating awareness on development, gender, discrimination, and human rights. We bring in well respected experts to lead these sessions, including the iconic development journalist P. Sainath, senior women's studies expert Professor Vibhuti Patel, filmmaker Aruna Raje, ecofeminist Dr. Vandana Shiva, and anthropologist, filmmaker, and gender studies expert Dr. Harjant Gill, who have all held masterclasses for us in the past. Today's masterclass, The Elderly in India and the Role of Media, is led by Dr. Sanjay Kumar, Population Dynamics and Research Specialist at UNFPA India, like my colleague told you. With over 3 decades of research in population dynamics, aging, reproductive health, and gender, Dr. Kumar, a PhD from IIPS Mumbai, has made significant contributions to demographic analysis and has numerous publications in reputed journals. Now let's talk about today's theme. Media shapes perceptions and policies, making fair representation of India's aging population crucial, especially for older women facing dual marginalization. Traditional media often portrays elderly men as wise and women as burdens, but evolving platforms are trying to break these stereotypes. Films like Badai Ho and Piku have highlighted this independence and the caregiving challenges that women face, while social media amplifies senior voices through influencers and bloggers. Grassroots initiatives too are bringing real life experiences into focus, expanding representation. And yet, stereotypes persist. Older men continue to be seen as respected figures, while women are sidelined, reinforcing narratives of aging as illness and dependency rather than empowerment. But how can media drive a change in this mindset? How can it expose elder abuse, pension fraud, and bring focus to widow pensions and financial literacy? And most importantly, how can Indian media foster inclusive portrayals that build a society that truly values and supports the elderly? For all this and more, I'm handing it over to Dr. Kumar. Dr. Kumar, it's all yours. Please take this masterclass away.
Thank you, Yogesh ji. Thank you very much. And thank you for providing a very good context about elderly persons. And today I will try to, unpack, why this phenomena is coming up in and what will be the scenario in future. And then towards the end, we will come to the role which media can play to portray elderly persons in a more positive way. May I request Anuja to put up the slides, please? Thank you. It's coming on slideshow mode.
It is on slideshow. I hope it's fine.
But it is disappeared.
We can see it.
Acha, you can see, but
Come back. We can see it. Dr. Kumar, please go ahead. We can see the slides.
Okay, okay. So, Anuja, let's go to the second slide. All right. So, what is population aging? Elderly and population aging, what we talk about. So, first, let us start with understanding the overall structure in the population, and then we will come to how elderly issues, how vulnerable are they, and what are the current situation. So to you, this is a term is called population aging. It means actually over a period of time, if the number and the proportion of the older person, that is, let's say, defined as 60 years and above, those whom we call it as an older person. So if that number and percentage increases over a period of time, so that is called the phenomena of population aging. Now, this in Indian context, we take 60 years and above, but in developed countries, it is considered as 65 years and above, given their life expectancy higher and all. But in India, still we consider 60 plus years, but anytime we can also look into data about 60 plus years. You will see that what will be the conditions later when you see some data. And nowadays, also the talk is going on, or the debate and discourse is there. Why should we have a fixed cutoff of either at 60 or 65? It should be progressive, and depending upon if a person is living more longer, so this should be keep on increasing. So that's kind of a discourse is also happening, which is called prospective cutoff age of for the aged persons. And they says, okay, if life expectancy increases whatever, so just what 15 years minus life expectancy can be taken. But still very different opinions are being there across the globe. Now, the question is, why over a period of time, number and percentage of older person increases? Actually, it happens because of two major factors. Firstly, is rising life expectancy or reduced mortality. It means people are living longer. So those who are born, those who are there in the population, they are living more. They are living more and more number of years, and every day we age. So even aged persons are living more. So it means they remain in the population, and that's why their numbers and proportions are increasing. But equally important is that we have a when the fertility declines, and in India we are seeing a phenomenon of decline in fertility. We have reduced our fertility level to the replacement level. So what its implication is that the fertility is low. It means less number of children are being born as compared to earlier where fertility was very high. So now if you see in the total population, the share and the number of persons, those who are 60 years above or even 50 years above, whatever you take, slowly it will start increasing. So that also happens because of the interplay of these two factor, which is called mortality, lower mortality and lower fertility over a period of time. And when this mortality declines, then fertility also declines. So it actually produces a lot of changes in the age structure of the population. So what is the age structure? So age structure could be taken into a broad age structure like children, young persons, or those who are productive or in working ages, and those who are old. Or maybe we can take 5 years, whatever. But there is a shift in the age structure because of the interplay of fertility and mortality conditions. And then we will show with you with some graphs and some data, you will understand clearly there. But before that, it is very important to understand that why we talk about it. So it has a larger consequences, economic and social consequences. Even if you see family structure, and now you see that how, because of the out migration, elderly persons are living alone, and and their children are going out in different towns to work. Similarly, it has a implications and impact on healthcare because when more aged persons are there, we have to take care of their health conditions and also the economic aspects. Then, after some time in future, the working age population will decrease, so it will has adverse effect on the economy. Next slide, please.
Uh,
Now, as you can see, it is the increasing number of and share of elderly persons 60 plus years in India. And we have plotted here a journey of, let's say, 1950 to future scenario of 2100. So, in fact, 150 years journey of the numbers and proportion is being shown here. What strikingly what we see is that in 1950 we have just 5.4% of people 60 plus, but as now after 75 years we are at the mid period of this 150 years journey, so we have around 11.4% of the population of India over 60 years and above. And in terms of its number, it is for this year, it is estimated at 162 million. But most strikingly, if you see that in 2050, in just next 25 years, it will proportion will get doubled. And also the number from 162, there will be a number of 346 million 60 plus people living in our country in just 25 years from now. And you can also see that how the curve rises further. And by 2050, one person in every 5% will be elderly, while around one third of the population will be elder by end of the century. So this is the trajectory of increasing number and share of older persons in India. Next slide, please. This is, I was talking about little bit on the age structure transition. So if you can just see, if we just take three broad age categories: less than 15 years, it means 0 to 14 years of children, then 15 to 59 years of working age population, and 60 plus is older population. And if you see, we have taken, let's say, from 2011 to another 50 years to 2061. So if you see the bottom line, where with the blue color, in 2011, around 31% of the total population was less than 15. So child population was quite high. Now, slowly it is going to decrease, and in another 50 years, by 2060, it will be just 16%. And on the other hand, if you see on the top, which was 8.4% in 2011, 60 plus, which will increase to 25.7% by 2060. And next click, if you can see that there are certain pyramids in the bottom. If you see, if we plot like 5 year age, so in 2011, then 2036 in midpoint, and then to 61. Now you see how the shape is changing. The pyramid is, bottom heavy earlier years, 2011, but slowly these people are living in the population, less number of children are getting added. So what is happening, that cohort is moving up, and this further in another few years, the cohort will further move up, and then they will come into an aged category. And that's what you have seen in the first chart, is that how the number and proportion will be increased. Next slide. Now, when we talk about population aging in India, so these proportion and numbers are not across everywhere, and there are different disparities and variations. And particularly, we talk about, there are three salient features of aging in India. The first one is the regional disparities. The second one is about the elderly women. Then we will see how they are coming up differently, and what happens to the rural elderly population. Next slide. If you look into the regional disparity, and region means I take it as states. So all the states are not at the same pace of, let's say, population aging. If you see in the map, the darker color of the green darker colors, where the proportions are very high. And if you see on the next slide, there's a bar diagram on the proportion of older person by state. You see states like Kerala, Tamil Nadu, Himachal, Punjab, Andhra, and to some extent Odisha, Maharashtra, Karnataka. So these the states where you have around 11% and even more than the national average population, which is 60 plus years. While other states on the bottom, if you see, their proportion are still lower. And the reason being why it is lower, because as you know that the trajectory or the decline in fertility and mortality conditions in each state is not the same. They are differed. I mean, now we also say the fertility, let's say Bihar and UP is still high. They have not achieved replacement level of fertility, while Kerala and Tamil Nadu, around 20 to 30 years back, they have achieved that one. So now they are moving towards aging society, while those states where fertility is still high, number of children are born, so we have more younger population. So their percentage of elderly population is not that much increasing or not as compared to others where the demographic transition has already been over a few years back. Next slide. I talked about the older women and population aging. So we are going to see the different conditions of the elderly women. And if we see one by one, if we just take the numbers based on 2021 data, so if we have 66.7 million elderly men, as compared, we have around 4 million more, 70.8 million of the elderly women as of now in 2021. So you see even numbers mismatches and you have more number of elderly women in our society. If we consider their percentage, next line, if you can see that out of all the elderly male, 9.5% are aged persons, 60 plus, while among elderly it is 10.7%. And furthermore, life expectancy at birth, if we want to see that, so during the period 2016 and 20, when we get this life table from SRS, so it is seen that average number of years a person who is born during this period is expected to live. If it is a male, it is 68.6 years, but life expectancy for women is much higher, around 2.9 years higher, 71.4 years their life expectancy. And even from the life table, if we take uh, life expectancy at age 60, so those during that period, if they turn 60, so how long they are going to live on an average. So it was found that 17.5 years for men, while 19.2 years for women. So women is going to live longer, around 1.7 or 1.8 years more. So even at age 60, around 17 to 19 years, either men or women, they are living. So it's not only that they are living, but they should be living a healthy life, a fruitful life, a completing life. So that is here the implication starts. How at the age of 60, for about 20 years on an average, a person is going to live. So how we have a healthy aging for these persons. So we take care of health conditions. Then another socioeconomic factors, if we see widowhood, for example. So uh, in male, based on LASI data, which we found is that only 16 or 17% of the males are categorized as widows, as compared to more than 50% of women, those who are in these categories. And there are obvious reasons for that. In India, the age gap between a spouse is around 5 to 7 years, and then you have a lesser, life expectancy, and age was higher of the husband, so they tend to die before women. So that's kind of a phenomena we see I mean, more than half of the elderly we have in a widow's condition. And if you see literacy levels for them, again, quite striking. More than 50% of men were literate as per LASI data, while only around one quarter of the female 60 plus were literate. So now you can understand their socioeconomic conditions. And even if we look into, let's say, sex ratio among elderly, so number of elderly women per thousand men. So if we have this data above, you will get 1061. It means for every 1,000 men, there are 1061 women. So that the sex ratio is highly favorable towards women, but they do have a different vulnerabilities. Next slide. If we talk about the ruralization, so where our elderlies are living, they are not living in the cities and urban areas where more infrastructure things are there. But if you see across the states and even country as a whole, around 70% of the elderly, they are living in rural areas. So even when we talk about an elderly person in India, the bigger phase comes, it's not that an elderly living in urban areas, but majority are living in rural areas. And if you want to see that how do we secure their health, how do we secure their income, how do we take care of their isolation? So probably we have to think that, okay, we are talking about a person living in a remote village, not in a mega cities or even other cities. So that's the picture. Is another salient finding is that we should think for how do we reach out, what we do to reach out to the people, particularly those who are living in rural areas. Next slide. Now I'll take you through some of the vulnerabilities which elderly face, and this is based on different sets of data. We got this data from our own UNFPA study, which we have done a few years back, and we found that around 26% of 60 plus men and around 60% of women, they were having no income. While even if you see the salary wages, employee pension, even social pensions for old age or widowhood pensions was quite, much below, around 13.7 for the men and 22% for females, where widow pension is also included. So these kind of scenario is that the majority of the old women are not having any income, and in the same case, around one fourth of the elderly men also, they don't have any income support for themselves. Next slide. If we look into another dimensions of vulnerability among elderly, so first let's talk about the status of living arrangement. And what we found that living arrangement means where are they living, with whom elderly persons are living. So this is based on LASI data. What we found, around 6% of the elderly persons, they are living alone. No one in the family, they are alone. But more important is another 20% is living either with their spouse, not either, but only with their spouse, so husband and wife. So around 20% or another 5-6%. So 26% of elderly in our country is either living alone or they're living with their spouse only without any physical support. So that's kind of a situation which we have got. It is good to know that around 40% are living with their children and a spouse, and another 27% with their children. But still, even if you see around a quarter of elderly are living in a very either two or one person in one family. If you see the next slide, social welfare schemes, what we found is that even the awareness of about the old age pension scheme was quite low. I mean, let's say about old age pension scheme, and that is called Indira Gandhi National Old Age Pension Scheme. Even the elderly, only half of the elderly, they say, oh, we know about that there is a pension scheme by the government. But if you see how many of them were getting the benefits, only 28 or 30%. So it's still quite low. Similarly, awareness of Indira Gandhi widowed pension scheme, particularly for widowed women after 40 or 40 years over. So among 60 plus, 44% were knowing about this and only 24% were getting the benefits. So again, the government's schemes programs are there. So it's a bit limited, and there is a lot of scope here how even when we talk about role of media, we can come back and see that how these things can be taken care towards the economic security of the older persons. If we talk about health status, so around 25% of the elderly from LASI data, they rated, we asked in the survey, how do you rate your health? So either very poor or poor. So if these two categories we combine, so 24%, so one quarter of the elderly, they perceive self-rated health is poor, either very poor or poor. So that's the overall health, summary indicator of health condition of the elder persons. And they are also suffering from various diseases like cardiovascular disease, hypertension, and less percentage, but still it's there that chronic heart disease and strokes and others. So we have just given few diseases, but other chronic morbidity are also there in the data. If anyone interested can look into and find that what is there. If anyone interested in the health profile of the elderly, can look into LASI data in more detail. Next slide. Here we just present a few things that what are the response has been given by the government. We have not listed all here, but overall major things that there is an impressive list of programs and schemes which has been started by various ministries of the government. And the other one is that in India we had an act which is called Maintenance and Welfare of Parents and Senior Citizens Act 2007, which is being actually revised. It has to be passed now. So this is a bill is there where elderly can, go to the court or tribunal to take maintenance from their own children if they are not supporting. So that's kind of a legal provisions has also been provided or guaranteed for the older persons. But again, there, how many people they go and they take this action there, and how many people they know is another issue. Government of India has in 2016 they have got they have established a fund which is called Senior Citizen Welfare Funds, and that huge amount of money from where many schemes are being funded. So there is a good sign there that government has a pool of fund where the schemes can be implemented in different states. Then they have come up with a national action plan for welfare of the senior citizens, and later it was renamed as Atal Vayo Abhyudaya Yojana, and where a lot of things are listed out to provide aids, hearing aids and others. So there are certain provisions there, but the question is how many people might be knowing at the ground, particularly in the rural areas, and they can take benefit of this scheme, these schemes, not only one. Next slide, please. We also have one of the things which government has started in 2021 and 22, and it is functioning. Is this is the elderly helpline number 14567, and it serves provide all needed support anytime anyone can call, like child helpline and something. So elderly helpline exclusively, and they also provide services. They link it to the, if any elderly in distress, and also the social welfare department reaches out to the elderly if the calls are being made to asking for the support. And also government is trying to attract startups for those products which are elderly friendly, and those who can do for the welfare of the aged persons and the services, the goods. So a startup being encouraged by the ministry. Then there are platforms, portals available where government persons after retirement can put there that okay, they are available to provide these services either with some money or even voluntary basis, whatever they can do. From the health ministry, we have a called National Program for the Healthcare of Elderly, NPSCE. So this is happening, and what they want in this program, what they are doing is that in the district hospital they have created a geriatric ward, so where aged persons are being admitted, separate ward is there. And even at PSC and CSC level, they are organizing OPDs exclusively for elder person once in a week, whatever the date they decide, mostly on Thursday. So these schemes are there. Next slide, please. If anyone who is interested, we have come up with India Aging Report, and not only the government response, but what the CBOs, community-based organizations, what CSR, what they are doing as an institutional response to take care of our elder persons can be found there. And you can there is a barcode there, or even in Google, if you find, you will find this report. So you will get more detail about various schemes, and probably look into, and then try to see in the field whether actually it is reaching out or not. So so these are the certain background information, and I thought let me just move to next slide, please. We move to the role of media, for which we are gathered here today, and then we are talking about particularly on elderly issues. So after just understanding that what is this aging phenomena, what are the vulnerability, how women comes out differently in terms of their vulnerability, older women. So what can be done? And I think Yogesh ji has very rightly in the beginning mentioned that everyone, just try to portray a good picture and say that what, it is not that always they are burdensome, there are silver linings. So how do we actually build on that and then try to improve their lives? So here specifically we have listed out few. But I think if this will trigger you, and then you can think of even more ways of trying to portray and trying to help the elderly. So let's take a few specific examples. The media can, one of the things they can do is to raise awareness among the general public, because there has to be some kind of a support system by a general public to take care of the elderly persons. So media can just portray what are the challenges and opportunities faced by the elderly persons, like ageism, poverty, social isolation, and how even the people can take care of those things, because they are also part of the same society. Similarly, media can also help to challenge for to challenge of that negative stereotype of older persons, and then they portray them in a more positive and dignified way. So that will also help to give a give a condition of dignified living by the elderly persons. On health and wellness information, we found that elderly often face chronic illnesses and morbidity and even mobility kind of a problem they face a lot. So media can educate them on preventive healthcare practices, fitness routines for elderly, and guidance on managing common diseases, like what to do when you have arthritis or diabetes or hypertension, where do you take medicine, how do you know that you have got hypertension or these kind of diseases. So those kind of a thing, one of the aspects where that information can be provided by media. Then also another important is combating isolation, because we also found that many of the elderly, they say that they feel loneliness. So probably media can help combat this isolation by creating platforms of virtual communities or forums, or can show in different channels different kind of engaging older adults, and then making them feel hard and that they are heard and connected. So these kind of, how do we take care of their isolation, and how do we integrate into the society, and particularly those who are even oldest old and all. So that will be really helpful. Another aspect we thought is that the media can give the voices to the older person by providing them with opportunities to share their stories, perspective, because they also have a wisdom of knowledge. But where they express, if you can help by your creative way, if they can express, they will also feel that their life is satisfied. They will also feel more included. Next slide. Another important aspect is that there, as what we said, there is no income for them, and in many places ESHGs are being formed. So at least media can help raise awareness about where are the employment opportunities, either voluntary or with money. So which can older adults can take up, and then they become more active, and also they gain from their engagement. So that will really help. So those kind of activities can be undertaken by media. And another very important aspects which we think that it is important to take care of the elderly is to have intergenerational bondage. And media can here be a very good, they can play a good role and then create platform for older and younger generation to come together. There are various means how do they do it, either through school programs or through community engagement. But again, if they share and they interact to each other, so younger generation also needs to know that we should, elderly is a very valuable human being in our society, and how we should respect and how to take care of that. So that kind of intergenerational bondage is required, and where media can play a much bigger role. Policy advocacy is also important, because the media can provide what can be done to improve the quality of life of the older persons, like where are the services lacking, which kind of services to be provided, whether the whole age friendly infrastructure of society is there or not, whether people are able to access because of their disability or their health conditions and difficulty in mobility. So those kind of things, can be advocated to provide for those age-friendly infrastructure, healthcare services, and even other services to the elderly. And lastly, I don't say that this is the only way, but there are many others. But in our list is last but not the least is that media can also advocate for the rights of the older persons. So they also have a right to live with dignity. So particularly those vulnerable, those destitute, those who are living in remote areas, how do we take care that nobody abuses them, neglect them, discriminate them, and how do we become the voices of the elderly and protect their rights. So with this thing, I just stop my presentation and back to Yogesh ji. So your voice.
Yeah, I'd forgotten to unmute myself. I'm saying we want to thank you for that perspective, but we will now open it up to questions. I'm sure people have joined and have lots of questions. To begin with, I would like to ask my own question. I would want you to talk a little about Dr. Kumar. What can be done to ensure that very often this issue is homogenized to an extent that women and the double marginalization that they face when they are elderly, that is often disregarded, and this problem is sort of seen as a homogenized thing. So how can we factor in gender into this issue and when we address it? Dr. Kumar?
Okay. So, but as I showed some of the data, what kind of vulnerability women face. Sorry. If you just start, the biggest vulnerability is that they are widows, and most of them, they say they are living alone, 5 or 6%, and even if you see in women, around 8% they are living alone. So there are definite issues are there. So what we can do is at least to take care of that, the most vulnerable section of the women elderly population. Have their income is being met or not? Are we able to provide some kind of support? And one more thing is that we have not talked about, missed it, that there are also problem with the nutritional status, and particularly for these women living alone, whether they have food or not. And we do have a good government program either in Anganwadi Center for Children, supplementary feeding, or midday meal program. How do we leverage actually to at least take care of destitute elderly? So that's very specific section which I'm talking about. But even in general way, they face a double burden. Even we have seen elderly women taking care of quite old husband, and she has a less strength and she is not having to keep someone to take care of the husband, but she is also providing care for other elder persons. So these are the other, double burden, which we talked about, what you said, is that, and we need to really find out some kind of, depending upon the context where what we want and where, which kind of category of women we are looking into. So what are their challenges? What are their needs? And then how do we address? And how do we highlight it? How do we, not only to the government, that the government is one, but also as a member of the society, civil societies, and others, those who can actually, provide helping hand and supporting hand to these vulnerable, particularly women. So I would say in that perspective.
Put on their cameras and raise their hands when you want to ask a question yourself. Otherwise, you can put it in the question boxes and Pooja will take those questions.
We have few questions in the chat box already. We have one question by Nalini ma'am. What about educating caregivers, family members potentially for mitigating loneliness and improving quality of life?
Okay, training of caregiver is also a very important thing. Is always we always look it from the other side. Is that okay? We are talking about elderly men, and they need care. Yes, they need care. Who is providing care? Another aspect of gender is most women, younger women, or daughter-in-law, or even daughter. They used to provide these kind of care services, and we have also seen that even there are burden on caregiver. And also is that for many things, caregivers are, they are informal, they are providing care, and They don't know even some kind of, like post operation, how to take care of elderly persons, and there could be specialized care. So yes, there is a need for caregiver. So that is, I'm talking about informal, which is the family caregiver. But on the bigger picture, we need to have a kind of some cadre in the community who are trained in providing services and help to the elderly persons. And of course, that can be, like we have got a servant to work in and providing, whatever that person does in our cleaning and something, and we pay. Similarly, we should have a specialized caregiver, and we are actually trying to map out what kind of needs and are having by different categories of elder persons, and then it will help us to map out and uh, try to advocate for which kind of cadre of caregivers and in how many numbers it is required and where it is required, either in Delhi or Calcutta or in remote areas in southern states and something. So a lot and lot can be done on that, and then we really have to work on that. We have started thinking, we are working on the direction, and we call it, care economy for the elder persons. So what is the status, what is the need, and what could happen in future? So there's another area of exploration and do a lot of work to the conditions providing care to the elderly.
Yeah, we have another question by Vinita ma'am. It says, what about the litigation that elderly have to deal with their children, especially women?
Okay. Okay, so it says there is a lot of litigation around the 2007 Act and increasing. Good judgment too. So I think this is a comment I see, is not a question. But again, what has been made in this provision is that it is to be by a tribunal, and where there is nothing, no interferences of any legal person, so that they can take money and other things. So those kind of things are happening. But good thing is happening that people are coming out, and but we have also seen that it is being suffered by stigma. Nobody wants to go and file a case against their own children. But still, if cases are increasing, so that is a good sign. But on the other hand, uh, we have also seen is that on the other side of the tribunal, those who are working for this act, they are also busy in so many things. So from there also judgment get delayed. So these things are also the reality. So yes,
Excuse me, can I add to that?
yeah, please.
I had asked the question so I can explain it further.
Yeah.
Actually, when we are talking about litigation, it is the children who are filing the litigation. It's not the parents filing the litigation, because they want the property. And if the parent decides to give a property to one child as against the other, or something like that, the other one will litigate. And then in terms of the gender of the two parents, if one parent is not there and the other parent chooses to give the property to one out of the two children, the other one files a litigation, a false litigation, and then litigation goes on and on and on. A person who is 80 years old, if litigation is filed against that person, how long can that litigation, the person fight for it? They have a limited time span, we all know. And then you expect to go to the court to fight those cases, and then over time the person will die. The litigation still continues. So I believe that there should be something, in terms of time frame of any litigation that an elderly person has to face.
I'm sure your point is very well taken, Vinita ji. Thank you so much for asking your question and making your point clear. This is also about the many systemic changes that are desired. But here I would like Anuja ji to come in and also weigh in on some of the issues that have been raised. I believe she's with us right now. Anuja ji, if you can come in now. Anuja Gulati is a senior program consultant with the UNFPA and looks at largely activities of the UNFPA in Western India. Yes, Anuja ji, please come in.
No, yes, definitely it is very distressing, what Vinita ji mentioned just now, and extremely difficult for older persons to navigate, litigations in courts. And this is a very, very critical area for policy advocacy. So thanks for raising that. And I'm sure Brian included as part of our activity. Sanjay, would you like to say anything? Because suddenly Yogesh came in to call me.
No, but I think this is an issue, and this is also related not only for the elder person, for any person getting for litigation and the time taken and all those things. And she's right in that for older persons, and if I mean, children trying to grab the property, they put litigation. I think only thing what we can, from our end as an intervention, we should, make aware of the elderly about the legal rights and legal procedures where we can be helpful for them to little bit mitigate, those kind of processes. But it is a whole structure issue, and that we can't even handle those things, it going to the court. And also,
But there have been some good judgments. There's been a judgment by the Mumbai High Court on, how legal notices cannot be sent, uh, uh, you know, uh, till the parents are alive, whether it's one, even if it's one parent. So there have been some interesting judgments, and we'll need to really look into this. And but yes, it's a point for advocacy.
We have few more questions. Should we go
I
ahead?
can probably come in on what Yogesh had asked, basically.
Please go ahead.
Yeah, what can the media do to highlight issues of elderly women? I thought probably the very critical thing that the media can do is to raise awareness on feminization of aging. We've shared statistics here. How is it that the media can share statistics? They can share human interest stories. They can probably get expert opinion on the needs and concerns of elderly women, weave it into stories and put it out there. The second thing I think was that can be done by the media is to write stories on the challenges and the disparities faced by elderly women, whether it is limited access to health, whether it is social isolation that Sanjay spoke about, the lack of inheritance rights, that women have, the low economic security. All those are issues that the media can write on. Media can also look at highlighting, I think, the health needs of elderly women, because the health needs of elderly women are very different from those of elderly men. They have higher risk of osteoporosis, arthritis, they have mental health issues because of neglect, because of social isolation. We know 1 in 10 elderly women stays alone. Write stories around that, highlight these issues, and also advocate for improved health policies and services for elderly women. Their need for assisted devices, maybe medicine for non-communicable diseases. How is it that these can be made available at the doorstep, as the Kerala government is now doing? Also, I think another issue that media can do brilliantly is to challenge ageism and gender stereotypes around aging by showing elderly women as active and capable members of the society. They can share stories of elderly women in leadership roles within organizations and panchayats at the community level. They can also share stories of elderly women who are engaged in entrepreneurship, business, and promote these positive role models. And I'd just like to add to what Sanjay said in terms of creating platforms for intergenerational dialogue. And I think one area where the media can play a very active role is by ensuring the creation of these platforms and motivating the elder to share their wisdom in the form of stories, maybe recipes, old recipes, home remedies on health, maybe interesting anecdotes, and young people can actually document these as blogs or bring them out as stories, and the media can provide a platform for such efforts. I think that could be one way where the media can be involved. I think that's it from me here, and we can move ahead.
Um, I also, Anujaji, thank you. Dr. Kumar, I wanted to also ask you about the fact that, we have on one hand, India has one of the poorest doctor to patient ratios of 1 is to 834, and we have also a bed to patient ratio, which is also woefully very, very low. So in that scenario, we have sometimes when we go to elderly care centers, when we go to hospitals, we see patients who do not have anyone, abandoned, people who are pushing, nearly pushing 100 and or nearing 100, and they have often asked that they be allowed to die in a dignified way. And so it is often it in the past people have raised this in the parliament also as a question, but nothing has come of it. But what would your perspective be on this, as someone who understands this issue?
So you're muted.
Sorry, okay. Could you hear me?
No, we could hear you. We cannot hear Sanjay, sir.
Sanjay, you're muted. Huh?
Dr. Kumar, you are muted.
Yeah. Okay, fine. Now it is okay. There was some problem. No, this is a very pertinent these things, and there are examples also, particularly old and all people. If they are not well, so people take it to the hospital, and after that they don't turn up, and it's very also difficult from the hospital side where to go and how to where is the family and find them out. And we know that there are certain NGOs, those who take care of these kind of those who are destitute. There is no family, and family has abandoned those persons. But I hope when we start talking about intergenerational bondage and other things, respect for the elderly, they also have a dignified life. If they can live with dignity, they should also die with dignity. So those kind of things which we need to really educate with the public, with the younger generation, and with the family members. On the other side, on the burden on the health system, you're talking about the ratios and all. Yes, it is there. Even if you go to any hospital, even for younger people, you see the big queues for OPDs and other. Particularly, yes, it is important that we should, expand that health facilities closer to where these people are living. And one of the good silver lining could be is that we have at the lowest level, at the village level, we have a sub center which has now been called as Health and Wellness Center, and they are mandated to provide 12 services, and immunization, taking care of pregnant women and all, and one of them is also elderly care. So at least we don't know what is the situation. We should one can do a study, one can go and see that what kind of care for the health care these people are trained to provide or not. But at least they can certainly look into provide their diagnostic things, check their BP. When they can check BP for a pregnant woman, why can't they do BP check for the older person? And then at least try to say that, okay, link to the health facilities where you can get some medicines and all. So these kind of, step probably in future will help. We are also trying to advocate that in the village, we see if 70% of the elderly are living in rural areas. And then even in for taking care of pregnant women and children, we have ASHA and other cadres. So why shouldn't we have a different cadre to take care of the elder person? And I think Nalini talked about leveraging telemedicine. That's very important, where they can go to nearest facility. And I would also say here is that the role of GP. If really GP, when we says we are working at age, I mean we are working for girl-friendly gram panchayats, why can't we can also start advocating for age-friendly gram panchayats, and they do have funds, and they are at the place where all the schemes of the government gets converged, be it a health scheme or pension and other things, and linking to the higher facilities where telemedicines and even Jan Aushadhi, generic medicines, all those can be at cheaper rates, can be. So there's a lot of a scope which we can really think of, and then we try to advocate. So that might be a solution rather than everything that, okay, we increase the number of health facilities, number of beds. Yeah, that's also important, but at least for the preventive and promotive care for the elder persons, and also for diagnostic care, so that they know that where they're heading for. So a lot can be done.
There is a question
Yes.
I see on, caregivers getting tired, and most of the available services that provide care are expensive, and how many people can afford it? Would you like to answer that? And then I'll come in, Sanjay.
Which is the question? I mean, don't know why.
This is,
Yeah, your voice was not very clear. If Pooja, if you can read out the question, if you see it there.
Yeah. Caregivers also get tired, and most of the available services that provide care are quite expensive. How many people in India can actually afford them?
Can I quickly come in and add a little supplement to that exact same question that has been asked? Dr. Kumar, also healthcare givers, whether it is the medical personnel or paramedical personnel, their caregiving is not age agnostic very often one sees. Even in interior rural hospitals or even large civic hospitals here in Mumbai, we see that very often if an elderly person arrives in distress, the doctors and the other staff want to attend to somebody who is productive and in that age group. And the elderly person says made to wait. So it's not exactly age agnostic. So how can we end up doing this considering the kind of strain already our systems are putting up with? So if you could add that when you answer this question.
Sure. See, look, caregiver, and I did talk about, care giving cadres, either providing care in the family or in the at the household level or in the hospital. So now we are trying that, our government is also trying that we should have more geriatrics, person, those who are specialized in, old age medicine. But at the same time, there is a need for geriatric nurses and caregivers. So there are institutions in India which they provide training, something like, bed assistant or some other kind of a things that these elderly persons will be doing. Either they are in hospital or they are at home. So bedside attendance and so many things. So, but probably I think there is a mismatch of, what we say is demand and supply. The kind of, care, this kind of, specialized caregiver, those might be required, might be not there in the market or in our society. Those who can sorry, those who can take care of, the increasing rising demand of these kind of care. So that is why I had, touched upon that we are working to find out what kind of needs are there for the care, because it is not just one, okay, I can just care to the elderly persons, but depending upon different, some could be physiotherapy, some could be bedside attendant, some could be something else. Even at the family, what kind of a cadre is needed, and then how we think for their training, and how do we decentralized in the country, not in a few states like, central places. So these are the certain issue, and again, this is there is also a data gap on that. We don't know what is the exact need, what kind of care providers we need, which kind, on which what expertise. So that's what we have started working on, this particular aspect. Probably, hopefully, let's say in future, we should come out with a mapping.
Can I make a suggestion, please?
Yes.
Actually, I mean, a lot of these problems and issues, I think, it's my personal understanding, is that elderly people are not looked at as productive people. In a capitalist society like ours, everything is measured in terms of your contribution. And unfortunately, the elderly who have already contributed to the society, that is kind of ignored. And they are looked at more as burden rather than productive agents of society. Until and unless we don't change this outlook. So like what you're talking about media role, I think can also emphasize on, the contribution so they have already made to the society, and hence the need to provide for them when they are, in their twilight years, when they're not able to work, and the importance of providing for them. I think then only some kind of understanding, or value for the elderly can be perceived. I mean, this is my own little bit of contribution that I thought I could make.
This is wonderful, Vinita ji, and that's why we've been saying, both Sanjay and me, that it's very, very important to challenge ageism and the gender stereotypes around it.
Yes, yes.
So that's why we discussed that, and very, very valid point. So thanks for adding that. Um, I was just thinking about the question of Juvair Sheikh, and one thing that occurred to me, and this is something that has been tried out in Tamil Nadu, which Sanjay mentioned, is the formation of elderly self-help groups. And what has happened in a couple of districts where this was tried out, the elderly were categorized into really active elderly, partially disabled, and very, very frail elderly. And these elderly self-help groups, in addition to being credit societies, also took up roles of assisting and supporting each other for a small payment and this is in the villages. And how this whole thing happened, so there were some elderly women who started doing meal preparations for other elderly who could not do it on their own and had no other support. There were other elderly who just said that we could probably get together, meet, provide emotional support. There were some elderly who were very active who said, okay, if you need to go to a hospital, we could take you and provide transportation support. So one is the whole aspect of intergenerational approach to aging, and the other is also formation of these elderly self-help groups who can support each other based on the category of elderly, but if they all come together, a 60-year-old could probably really support an 80-year-old in these village settings. Yes, caregiving is today expensive. Caregiving for the elderly is expensive, but the more we open it up, the more geriatric nurses that we have, when there is a supply, probably the costs will start coming down, like Sanjay mentioned. It's still an emerging area, and will take some time for it to evolve. But yes, government has now started putting in place several aspects like weekly clinics for the elderly, all of that, geriatric clinics, they are weekly. And adding to that is the question by Vidya, where she says, why don't we have fixed day health checkup camps for elderly like the cataract camps? That's also a valid suggestion. Currently, weekly static services have been initiated, but this is another thing that can be included as part of the advocacy.
So you
Any other questions?
Any other questions are there? If
There is this question from Abhijit which says, what can young filmmakers and journalists do to improve the representation of the elderly in media?
I think this is a great question. If both Anuja ji and Dr. Kumar can come in and tell us, because very often, there are these stereotypical characters that, when it comes to elderly, they are generally pushed into that slot, and then it becomes, more of a caricature than anything else. If you could also cite any examples where you thought something was done right in terms of elderly, the way they were portrayed, then that could provide perhaps for a template where people understand that this is the way it can be handled. Anuja ji and Dr. Kumar?
Okay, I think Anuja will tell much in a better way, but I can just take an example. The way we started that Ladli Media Award for the girls, then so and it's similar on that aspect, and I think Anuja has led that work. So probably I will request Anuja to chip in. And then how do we influence the filmmakers, journalists, or something like where you do it for girl child, so why can't we do it for the older person? So Anuja, over to you. Thank you.
I will only say, that like Vinita ji mentioned, share what have been the contributions of the elderly. I mean, in a film, that could be done in various ways, more creative ways. And also, again, I say challenge ageism. Show elderly as active and capable members of the society. They're not always dependent. In fact, a vast majority of elderly women are caregivers within the family. They are, engaged in entrepreneurship, and we've seen that. And you know so this is something, and that can really be taken up by the media. Yogesh, to respond to your question on some examples, I think the example of Lapata Ladies itself, where this elderly woman who's frying bhajias on the station is supporting the young bride who's lost her way, is a brilliant portrayal of an elderly woman and how she inspires her to engage in gainful employment. I think it's such a brilliant portrayal. And
Yes, I agree. Yeah.
and I couldn't agree more with Sanjay that we probably include this as a separate category under our Largely Media Awards, so we can discuss this going forward and see what we can do in this area. But there are several such portrayals of elderly, but this is what just came to mind. Reena, I think you have your hand up.
Okay. Yes. So we have. I think if there is any more questions, people can raise their hands and ask those questions.
I just wanted to say one more thing. I remember Population First doing a very great job of creating awareness amongst students in colleges, with reference to rights, like you were talking about the right to dignity of the elderly. I wonder if that kind of program still exists. It was with reference to women and children, but I don't know about the elderly.
Well, we do look at gender sensitivity as
Across
a training
categories.
workshop. We
Yeah.
conduct workshops in many educational institutions like this, and it will be our endeavor to make this a more pronounced component within that. It's
Yeah.
not like we have completely not brought up the elderly, but we have mentioned them in the passing. But you're right that it would do, we could all do more and better. So your point is very well taken, ma'am. You're right that we need to all do a lot more.
Uh, well, one is need to do a lot more, but a lot of the stories around feminization of aging have won the Ladli Media Awards, Vinita ji.
Okay.
And Yogesh, again answering your question, there is this brilliant English film called The Intern, and how this elderly gentleman helps to change the perspective of a young woman. So I think that's another brilliant example of positive portrayal of the elderly and how ageism is challenged in the media. And I'd encourage colleagues here to, take a look at that. Yes, Reena, sorry, we went back to something else. Over to you.
No, I know. Unfortunately, what Anujaji is saying is right that very often, while these are exceptions, largely you notice that, there will always be this gnarled old person who is very often seen as a burden or someone who's interfering and is seen as someone people that other characters find it a problem to deal with. So it's always made out to be a sort of an obstacle in the household. So I just feel that these tropes that filmmakers often fall into also need to kind of be addressed, and better sensitization needs to be there. So overall, it is also linked to where we are as a society and the downfall in the idea of family and the use of pronouns like we and more and more as I.
Um, I wanted to take up the cause of the safety and security of older people. We have a lot of cases where they are, they're living alone and then, they get murdered. In Kolkata, the police started something called Prona, where, the neighborhood police station would have somebody going away. Generally, a home guard is put on that kind of, voluntary, as a volunteer in among the community, and keeps a tab of the elderly people in the neighborhood. So this has been working pretty well, and I think that that kind of thing can be emulated, because we know of, the kind of dangers these people face when they live alone, especially women.
Yes, Veenaji, that's a point very well taken. Couldn't agree more with that. There are a few small examples in the country, including in Tamil Nadu. Again, I go back to Tamil Nadu, where there was this van that was started called Amma Patrol. It was mainly meant to address violence in public spaces, and if anyone saw a violence occurring in a public space, they could call up a centralized number. But over a period of time, it also included elderly women, who had an issue of safety or security. They could call up the centralized number, and a police patrol would reach them as soon as they could. So yes, there have been such experiments that have been done across the country, and rightfully so. Very, very important point.
Even in Delhi, Anuja, the Delhi police has started this program that they enroll every elderly. At least they have their records available. Either they are living alone or living with the family, whatever it is, that they are the elderly. Then I asked one day, what do you do? He says, we know that their birthday, so we go and meet them and greet them. That's fine, but I hope these kind of small examples, and if they can show a good story out of this thing, how they took care of the safety and the security of the elder persons, can bring forth further others to get motivated and do something like this. Yeah.
In Mumbai, also, we have an elderly helpline that the police provides, and in some police stations, for example, the I know for a fact that the DCP Bandra had instituted the very same practice that elderly, or all the elderly, they will, like, police chowki after police chowki will have a sort of a get together in between with them, so that you get to know about their well-being. But these, while they take off, like, we are all what in Marathi we call aramba shoe. So they start as great projects, but then somewhere down the line they peter off. For example, now recently somebody told me that whenever they call the elderly helpline, all they get is like a busy tone for a very long time. And how
Mm.
long do you expect someone who's 70, 80, or 90 to keep on trying a number and not being able to get through? So those aspects also need to be addressed if we have to make a success of these attempts.
Yeah, there has to be continuous attempt on that to continue
Follow up is
follow up and continue that activity. That's true. So there is no one to listen to elders. Somebody has asked this one. This is, yeah, because they really want to talk to someone. And we have seen in other countries that there are devices like, to AI. So a person can speak to that small device like radio and something, and then ask questions. But it should be connected by internet. That what is the good news for today? I want to tell you a story. So like if one person would talk to machine, but these kind of a things is not everywhere, and what we are trying to advocate is to work with the technical institutions like IITs and others, that they should try to do some innovations on some kind of things for elderly taking care, something like even walking strict with sensors or torch and other things, which should be affordable for retained conditions. So another use of technology for the elderly is another big area where we can think of and advocate to work.
I would again go back to the intergenerational approach to aging, at least at the community level in villages and gram panchayats. How is it that young people can actually be linked to elderly in the villages? How is it that they can meet with them, interact with them, listen to their concerns, and also, provide safety? And in turn, to ensure dignity of elderly, the elderly can share all their knowledge, their wisdom with these young people. And that's a very key area. I feel the media can play an important role in, and if the young people start documenting these things, how is it that the media can publish, use the voices of the elderly to advocate, write blogs about their needs, their concerns, write blogs about the stories, the recipes they learn from the elderly. I mean, it would make it such an enriching experience, I feel.
Absolutely. I cannot agree more. Anujaji has hit the nail on the head because if we learn to celebrate them and the legacy of, I wouldn't say knowledge, but even wisdom that they uh, have with them, then it will actually give people a reason to reach out to them and keep celebrating them, and that will be a great intervention.
So if there are no more questions, should we then?
Yeah, I think though we'll encourage. I will say if there are no more questions, I would like to go ahead and on behalf of population first and all the people who've joined in. I would like to thank Dr. Sanjay Kumar for making time from his busy schedule to conduct this masterclass, which has been on many instances insightful, and in some instances, rightfully so, it has been insightful. I mean, INCIT, FUL also, because it should fill us with anger that we are being complete failures on some fronts. So I want to thank Dr. Kumar for this. I also want to thank Anuja ji for her inputs and for helping us coordinate this. We want to be obviously have to thank UNFPA for supporting this initiative of our masterclasses, and overall to all the people who joined in and will now watch this on YouTube. I want to thank them as well because without you, there is no point to this kind of an initiative, you know. So your participation actually makes it also worthwhile. Thank you also. Thank you one and all, and thank you Pooja for coordinating.
No problem.
Thanks to all of you at Population First. We'll call it a day.
Thank you.
Thank you, sir. Thank
Thank
you,
you, Dr.
Anuja.
Kumar.
Thank you. Thank you. My pleasure. Okay, bye.